It is the intention of government to make sure that every Kenyan accesses medical services, that every Kenyan accesses healthcare services. It is now 2 months plus since we started out the registration rollout. The numbers are picking up, but they are not good enough. We want to urge every citizen of Kenya to register under the Social Health Authority so that they can be beneficiaries of Taifa Care. It has a better package because from the impact stories that we have heard from some of the patients, especially critical patients of critical illnesses, those who have undergone kidney transplants and heart-related diseases treatment. This Taifa Care offers a better package, especially for post-transplant treatment cases. In many of the cases, I have been informed by the patients themselves that the process of getting services is fast, outpatient, and even inpatient. And even the approvals for the bills is taking a very good record time. This is not the first time we are trying this. The NAC administration attempted this. It didn't succeed. The Jubilee administration attempted this. It didn't succeed. And because of the previous attempts, this time round, we will succeed because we can learn from the other two attempts what were the administrative, legal, and even procedural constraints that made the other attempts not to succeed. So we are very sure that Taifa Care will work. Universal health care for everyone will work this time round. And I want to assure the people of Kenya that we will continue with this exercise of impact assessment, impact monitoring, not just at KNH. We may have started at KNH today, but we are going to other points of service delivery, level 4 hospitals, level 3 hospitals, level 2 hospitals, because there are, again, challenges that are at other levels of facilities, which are in a different level than KNH. And again, we are addressing those ones, including the hospitals that are under county governments. The national government will work in collaboration with county governments to address those bottlenecks around, especially referrals in level 2 and 3 hospitals, and also around diagnostic capacity of those lower level hospitals. The claims, many of them have been paid for under SHA, except where there are more administrative issues. I think that bit is okay. But the facilities, many facilities are still having a bit of issues because of the historical debt accumulated under the NHF. That historical debt, the government is also trying to offset incrementally because, again, the resources may not be enough for us to do everything at once. So we are committed to deliver this program. The East Africa Kidney Institute, which I have said is ready, is a center of excellence for renal care for this region. So it's going to be an international standard facility for renal care. It's going to offer not just dialysis services, but also kidney transplant services, cutting down the expenses, the logistical nightmares of many, many patients from Kenya who have had to travel out of this country for kidney transplants and other related services. So it's going to be a one-stop shop for all renal treatment related healthcare services. And in a few weeks' time, it will be commissioned. Actually,